So let me go back to you, Bart, and ask you, at some point in time, you decided to join HODS, to join Hands-On Diagnostics Franchising. Why did you decide to join HODS? What were you trying to solve, or what were you trying to achieve before you decide to join HODS?
You know, Dimi, I think we've had some vague parts of our profession without diagnostics that probably all physical therapy practitioners have run into over the years. One of the biggest things that we were trying to solve is that conundrum when, whether it be a back patient that the surgeon has already said, hey, look, I need to do back surgery on you, but the insurance company won't allow me to do this surgery until you failed at physical therapy. So we're going to go ahead and send you for 6 weeks of predicted failed physical therapy so the therapist can say that it didn't work so that I can do surgery. Or the same type of situation that we run into from time to time as therapists, where we get a shoulder patient that comes in and the doctor says it's shoulder pain is our diagnosis. And so we kind of start treating in the dark, hoping that we can get that patient better. And sometimes with our orthopedic tests, we hone in on the structure that may or may not be totally injured there, but we don't have a degree of diagnostic clarity before we get to an MRI to give us the direction of how to treat that most effectively and how to get our best outcomes. So I think between those two things as a practice, we got together and started to say, what else is out there to expand our physical therapy base of knowledge so that we can do the best for our individual patients day after day, giving them the best healthcare at really a more cost-effective rate. And so that's some of the things that brought us to HODS in trying to answer those questions.
Yeah. And oops, before I get to Joe and Angie, just talk to us a little bit about the traditional model of physical therapy versus the model of physical therapy that includes the diagnostic testing.
You bet, Dimi. And this is something that, boy, we've been so pleased in our practices to see a change in, because typically somebody comes in for physical therapy and we really do evaluate in our best ability or orthopedic plan there, create with that treatment plan. We intervene and we just kind of reevaluate and adjust that plan, do some more PT, so that either we reach the goals or we hit this barrier where the patient didn't achieve those goals, didn't achieve what we set out to do. They're frustrated, we're frustrated, and frankly, without more expensive diagnostics in maybe MRI or some of those types of things, we've had a negative experience with that patient, and really, in some of those cases, didn't help them the way that we intended from the beginning. Now, of course, in that traditional model, a lot of our patients still do get better, but there are those harder patients that we didn't know from the get-go, so we treated to our best of our ability. With diagnostics, it changes the whole game plan. Instead of really starting out with only the PT evaluation, day 1, day 2, we're doing diagnostic testing, whether that be EMG or musculoskeletal ultrasound. And then we develop a treatment plan, and that really is based on more objective data. And as we then go through that treatment plan, we even adjust it based on what we found on during that diagnostic testing, go perhaps a different direction. And at the end of the day, we find that our outcomes are much, much better. Often we do a retest, a lot of times with musculoskeletal ultrasound, to be able to show the patient and the physician that the treatment intervention that we're following at 4 to 6 weeks into the care really is making the difference that the patient is also feeling when they tell us that their pain is reduced from 8 out of 10 to 4 out of 10 in that scale.
Awesome. That brings me actually to add the fact that there is evidence on this which we identified in a study that we recently published at the Journal of Bodywork and Movement Therapies, that showed that 62% of the patients that received an EMG test, they had a change in the patient management because of the results that we identified in the electrodiagnostic studies.